Welcome to The Healthy Body. Dr. Alex here. Today we're diving into a topic that many men think about, sometimes worry about, and often keep entirely to themselves. How long does sex really last for most men? Not the myth, not the movie scene, not the overblown locker room claim, but the reality measured by stopwatch, in real couples' bedrooms around the world. This might seem like a straightforward question, but as you'll soon see, the answer is surrounded by myths, misunderstandings, and pressure that can quietly eat away at confidence. So in this video, we'll unpack the actual numbers from scientific research, explore how those numbers compare to what men and women think, and talk about what this means for your performance, confidence, and relationships. I also want to give you professional tools and strategies. The same advice I'd give my own patients for improving your sexual satisfaction, whether you last 30 seconds, 6 minutes, or 60 minutes. By the end, you'll see why there's no magic number, and why chasing one can actually make things worse. Section 1. The pressure of unrealistic expectations. In today's world, sex is everywhere. In movies, TV, social media, advertising, and even casual conversation between friends. Unfortunately, much of what's shown is pure fantasy. Actors in adult films can last for hours on screen, but remember, those scenes are filmed in multiple takes with breaks, editing, and sometimes even enhancement drugs. Mainstream movies often fade to black just as things begin, leaving your imagination to fill in the rest. And then there's locker room talk, where a friend casually brags about lasting half an hour, or says something that makes you feel like you're underperforming. The problem is, most of those claims are either exaggerated or based on completely different personal experiences. The result? Many men begin to compare themselves to an unrealistic benchmark. That comparison breeds anxiety, and that anxiety, ironically, can make lasting as long as you want even harder. Section 2. The science behind the numbers. Now let's turn to the real data. In one of the most thorough studies ever conducted on this subject, over 500 couples from around the world participated in a simple but revealing experiment. Each couple was given a stopwatch. They were instructed to press start the moment penetration began, specifically penile vaginal penetration, and stop the moment ejaculation occurred. This measurement has an official medical name: intravaginal ejaculation latency time, or IELT. It's important to note, this study did not include foreplay, kissing, touching, or other forms of intimacy, just the time between penetration and ejaculation. Why is that distinction important? Because sex is much more than penetration alone. For many couples, intimacy before and after penetration matters just as much, if not more, than the penetration itself. But for the sake of accurate measurement, the researchers needed a clear, consistent definition. Section 3. What men think versus reality. So here's where things get interesting. When men were surveyed about their ideal duration for penetration, the average answer was around 16 minutes. When asked how long they believed the typical man lasted, the average guess was about 9 minutes. Already, you can see a gap between the ideal and the perceived average. But here's what the stopwatch data actually revealed. Across all 500 couples, the true average IELT was 5.7 minutes. Yes, you heard that right, under 6 minutes. Section 4. The range of results. Of course, 5.7 minutes is just the average. The range was huge. Some men ejaculated within seconds, as little as 0.1 minutes, while others lasted as long as 55 minutes. But the reality is, the vast majority of men fell somewhere in between those extremes. And here's a fascinating detail. The numbers varied by country. In Turkey, the average was 4.4 minutes. In the United Kingdom, it was almost 10 minutes, the highest national average in the study. These differences could be influenced by cultural factors, physiology, sexual norms, or even the way people approach intimacy. But whatever the reason, the key takeaway is this: if you're anywhere near that average range, you're in perfectly normal territory. Section 5. What women say they prefer. Now the next question is, what do women actually want in terms of duration? There's no stopwatch-based scientific study on this, but a large online survey of 4,000 women revealed something interesting. On average, women said they preferred about 25 minutes of penetrative sex. That's much longer than the 5.7-minute reality, and longer than the 9-minute typical guess men had. But remember, sexual preferences vary widely from person to person. Some women prefer shorter encounters. Others enjoy longer sessions. And these preferences can change with age, emotional connection, and comfort in the relationship. Section 6. Why chasing numbers can backfire. Here's the problem with focusing solely on duration. It turns sex into a performance test instead of an intimate experience. When you're mentally counting minutes or worrying about how long you've lasted, you're not fully present. That anxiety activates your body's stress response, which can make it even harder to control ejaculation. Or for some men, can make it harder to finish at all. The truth is, quality beats quantity. A shorter session that leaves both partners satisfied and connected is far more valuable than a marathon that leaves you both distracted or disconnected. Section 7. When it's a concern. That said, if you or your partner feel unhappy with how long you last, whether it's too short or too long, it's important to know you have options. Two common issues are premature ejaculation, reaching climax much sooner than you'd like; delayed ejaculation, difficulty or inability to climax at all. Both are common. Both are treatable. And neither should be a source of shame. Section 8. Professional help and strategies. If you're struggling, I recommend 2 key steps. First, speak to a board-certified urologist. We can assess whether the issue is psychological, physical, or both, and help you find the right treatment path. Second, consider working with a certified sex therapist. They can address the emotional and relational side, helping you and your partner communicate openly and reduce performance anxiety. Section 9. Practical at-home techniques. Beyond professional help, there are strategies you can try at home to improve control and satisfaction. The pause squeeze method, stopping stimulation and gently squeezing the base of the penis before climax to delay ejaculation. The stop-start technique, slowing down or pausing stimulation several times before climax to train control. Mindfulness and breath control. Staying present and controlling your breathing can help reduce arousal spikes. Strengthening the pelvic floor. Kegel exercises aren't just for women. They can help men improve sexual control. Section 10. The big takeaway. At the end of the day, there is no universal right number of minutes. The only number that matters is whether both of you feel satisfied, respected, and connected when it's over. So stop chasing a stopwatch. Start focusing on pleasure, intimacy, and connection, and the rest will follow naturally. I'm Dr. Alex, and this has been The Healthy Body. If you found today's conversation eye-opening, subscribe for more science-backed, judgment-free discussions